Here in Milwaukee, health officials want to downplay any serious worries about the virus coming here.
Still, healthcare providers say they are ready to protect the community.
Jonah Kaplan is here in the studio to explain. Jonah.
Stephen Carroll, 2 months ago, the state health department released these guidelines for Wisconsin hospitals and doctors. Even with the news, though, coming from Dallas, these protocols have not and will not change.
Ebola first arrived in the U.S. back in August, when 2 American volunteers in Africa sought special treatment at a hospital back home. The virus has killed more than 3,300 people.
As long as the outbreak in Africa continues, both in terms of the magnitude and expanding to other countries, the probability of seeing other cases here in the U.S. increases. That's because of, again, business or recreational travel. But it's how we deal with those cases when they're here that will really determine whether or not outbreaks or clusters occur.
Today we learned someone contracted Ebola in Liberia and traveled to Dallas via Washington, D.C. The incident has provoked fear throughout the country, but not amongst health officials, including here in Milwaukee.
It is a containment strategy here, and that's similar to any other communicable disease we deal with: measles, mumps, pertussis.
All hospitals received the following guidelines. Take special care with anyone who traveled to West Africa within the last 3 months, or come into contact with anyone who has.
If they do fit that picture, and that'll be a very rare subgroup of patients, if they do fit that picture, then we would run the appropriate tests, have them in the right environment.
Dr. Sid Singh, a chief medical officer at Freighter, says physicians must report any case, send a specimen to the CDC, and prepare infection controls like isolation and incinerating any linens used.
There's no alarm. It gives us an opportunity to re-message to our staff, to our doctors, to our nurses, that this is an issue we need to keep on the top of our minds.
And again, you can only get Ebola through direct contact with body fluids with someone who has Ebola. You can't breathe it in through the air. You can't even get Ebola through the water. And you can't even get it through eating any food. In the CDC's words, the virus poses no significant threat to the U.S. Stephen Carroll?
Yeah, those are reassuring words. Thank you very much, Jonah.